Some parents actually report being able to see some signs or symptoms pretty early. So even like at 6 months old, you might notice that your baby is not making as much eye contact. So if you're nursing or giving them a bottle, not looking at you while they're doing those things. Around 1, you might notice that there's not as much babbling or communicative gestures. So at about 1, babies start to do things like wave or say no, they don't want something. And babies with autism spectrum disorder might not use those gestures yet to communicate. You could also notice things that might make it seem like the child is deaf. So not responding to their name, not responding to other sounds that children might respond to, but then they'll respond to something else and you're like, oh, they're not deaf because their favorite show is on and they ran to that, but when you're calling their name, they're not responding to that. And then after the point of 2 years of age, it would be kind of similar things. So maybe delays in social skills, not trying to play with other children as much as you would expect, being more to themselves. If speech is delayed or behind, that would be a possible indicator of autism. Also, if speech is repetitive. So if they have some words and phrases, but they're just repeating things from television shows or repeating things that you say, so it's not spontaneous speech, those would be some other things to be aware of. So autism spectrum disorder is a combination of kind of 2 differences. And the first would be a difference or a delay in social skills. So that's kind of like the main hallmark of autism spectrum disorder. So that could fall in a couple of different areas. The first one would be a lack of back and forth communication. So the back and forth skills are not there. So maybe conversations are different or delayed, or for younger kids, not sharing things. So not pointing to show you stuff that they like, not sharing their enjoyment, not playing social games with you. So if you're playing games that are more social and not physical, not noticing nor caring about those things. Another social area is lack of nonverbal communication. So people often think erroneously that it's a lack of eye contact. And it might be that the child lacks eye contact, but they could also have really good eye contact and not use gestures appropriately, or their facial expressions or affect might be blank. And then the third possible difference in terms of social skills is just having a hard time relating to other people, not recognizing social cues, not playing with toys appropriately, not playing with other kids appropriately. The second part of autism spectrum disorder is repetitive or inflexible behaviors. So inflexible means having a hard time when something is different, having a hard time with a schedule change or a new food, or if they're playing with something that they really like, that being removed. So just being inflexible, needing things to be a certain way. The repetitive piece could be any kind of repetitive body movements, repetitive use of objects, or repetitive special interests. So constantly talking about something or researching something, knowing more about something than other kids their age would. It might be that they're overly sensitive to things, so like sounds are too loud or lights are too bright, or that they're seeking out sensory things. So you notice them like smelling things or listening to loud things. So all of those things go into autism spectrum disorder. As soon as you notice some concerns would be a good time to start addressing them. So pediatricians can do some screeners in their office. There's a screener called the Modified Checklist for Autism in Toddlers, and that's the MCHAT, and they can do the MCHAT in their office while they're a toddler age. You could also do the MCHAT online and bring it to the pediatrician, like, here are some signs that I'm noticing, can we do something about this? In our clinic at Children's Hospital, we start testing children at 18 months, so if you're noticing some signs early, we can obviously address them at that time. The reason that I say the earlier the better is because early intervention really is important for autism. The first is that with autism, the idea is that social things are hard to understand. So the social world is difficult to navigate. So if you can make expectations really clear or make it clear like what's going to be happening, that might make it easier for them. So largely that's like visual things. So a visual schedule that either has pictures of what's gonna happen or a checklist that shows what's coming up, what's gonna be happening next. So timers might also be helpful, and visual timers are really great, and that just signals that time isn't going to last forever for something. Like this really fun task has an ending and here's when it will end. You can also order a visual timer if you Google that, and the idea of a visual timer is it just shows how much time is left with a color, so they can see. It's not just like this 5 minutes, they can actually see what 5 minutes is. Motivation and praise is another thing to use. So praise, We're just focusing on the good things. So if there are some good things that they're doing, some behaviors that you want to see or want to increase, praising them and praising them with what we call labeled praise. And that's just being very clear about what it is you like. So instead of just saying, great job, you say, great job sitting, or great job walking slow with me. So they know what it is that you liked. And in terms of motivation, just making fun things happen after things that aren't so fun. Here at Children's Hospital, we offer a variety of services for individuals and their families with autism spectrum disorder and other developmental disabilities. Those kind of services include parent workshops or caregiver workshops, individual therapy where we're working with the family on some targeted intervention goals, and then evaluations from children between 18 months to 21 years of age.